Get your free blood pressure education. Certainly. Blood pressure is an important vital sign that helps to determine the health of your heart and blood vessels. It is important to know how to measure your blood pressure, when to go to the doctor, and what to do if you have high or low blood pressure. Measuring blood pressure. To measure your blood pressure, you will need a blood pressure cuff, a stethoscope, or an electronic blood pressure monitor. The cuff should be placed around your upper arm and inflated until it is snug, but not uncomfortable. The cuff is then slowly deflated while the person measuring your blood pressure listens for your pulse. Your blood pressure is measured in millimeters of mercury and is represented by two numbers. The first number, the systolic pressure, represents the pressure in your arteries when your heart beats. The second number, the diastolic pressure, represents the pressure in your arteries when your heart is at rest between beats. Normal blood pressure is less than 120/80 millimeters of mercury. When to go to the doctor? It is recommended to have your blood pressure checked at least once every 2 years if your blood pressure is normal. However, if you have a family history of high blood pressure, or if you have certain medical conditions such as diabetes, kidney disease, or heart disease, you may need to have your blood pressure checked more frequently. It is also important to see a doctor if you experience any symptoms such as chest pain, shortness of breath, or dizziness. Getting knowledge about blood pressure. You can get knowledge about blood pressure from a variety of sources such as your doctor, a registered dietitian, or a certified personal trainer. The American Heart Association also has a wealth of information on blood pressure, including guidelines for healthy blood pressure and tips for managing high blood pressure. What to do if your blood pressure is low or high? If your blood pressure is consistently low, you should see a doctor to determine the underlying cause. Symptoms of low blood pressure can include dizziness, lightheadedness, or fainting. If your blood pressure is consistently high, your doctor may recommend lifestyle changes such as weight loss, exercise, and a heart-healthy diet. In some cases, medication may also be prescribed to help lower your blood pressure. Public awareness about blood pressure. It is important to increase public awareness about blood pressure and its importance in maintaining heart health. This can be done through education and outreach programs, such as health fairs, community events, and social media campaigns. It is also important to encourage people to get their blood pressure checked regularly, and to seek medical attention if they have any concerns about their blood pressure. Thank you for taking the time to learn about blood pressure. Remember, monitoring your blood pressure and maintaining a healthy lifestyle can help to prevent heart disease and stroke.